So greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students through retirees and anywhere in between. Today, I am very, very pleased to welcome Ruth Sutherland. Ruth says that she wanted to be a nurse as far back as she could remember. And she graduated in 1983. So this past summer made it 40 years that she's been doing this. During this time, she slowly worked her way across Canada. And her experiences include pediatric emergency department, rural emergency department, urgent care centers, headache assessment and management programs, rural hospital and young offender and sex offender group homes. After needing to take a medical leave, Ruth was searching for alternatives and came across a course that allowed her to continue to help people by helping them become their own health advocates and providing them the most accurate, up-to-date information that they need. Ruth is a wife, she's a mother-in-law, and she's a grandmother. So welcome, 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 Ruth.
Thank you. It's wonderful to be here.
It is my absolute pleasure, my absolute pleasure. Firstly, though, why? Why did you become a nurse? What drew you to it?
Well, my mom was a midwife in England, and I'd hear stories as I grew up about different deliveries she'd gone to and how she'd worked with the kids in the hospital. And I always enjoyed helping people. I was the oldest, and I just liked to make people feel better. And so that's what drew me to it.
As the oldest, I get that oldest thing. So you saw your mom doing all of this. And so it inspired you at a very early age. You said as far back as you can remember. So that means to me that you had a certain picture. When you got to be a nurse, did those two mesh? Did the picture you had in your mind translate into what it actually was?
At that time, it did in 83, because at that point, nurses training was definitely geared towards comfort and geared towards, we were able to do a little bit of the extras. You could give a back rub. You could take time to talk to the patients a little bit. That has unfortunately changed over the years. So it was, I definitely got to do some of the caring.
Were there any challenges for you though?
I think as it got busier, I found it hard driving home at the end of a shift and knowing that I could have done better.
Yeah.
And I had to, over the years, as there were more and more days like that, I actually had to objectively almost look at the shift and say, okay, was there something that I could have done? Or was it just that I was busy? And look at it as whether it was an issue with what I did or if it was a process issue. And if it was something that I did, look at it. Okay, what could I have done differently? And if it was a process issue, look at the process and see if there was something that I could offer to change the process and make things better. So that was one of the things. The other thing, I worked in a lot of different areas. And so when I would go into a new area, having to prove myself, which got better, when I had more gray hairs. But I had to become comfortable in my own skin and be confident in the fact that I was a good nurse. I did know what I was doing, but I did learn asking questions.
Yeah.
Helped. and listening to what the answers were, and not just talking to my peers, but talking to housekeeping, talking to the unit clerk, talking to everybody, and acknowledging that they had important information that was going to help me as well.
Absolutely, absolutely. And I'm so glad that you said that, because sometimes we forget that these people that we consider to be ancillary workers are essential parts of our team.
Exactly.
Essential parts of our team. Yes, they are. Yes, they are. So
Yeah.
you talked about looking at processes and seeing if there were things that you could change or offer to help change. What, if anything, then, what is the biggest thing you think you'd like to see change?
I would love to see nurse-patient ratios change. And some of that is starting to come about in Canada. It's been slow, especially with COVID. I think it's going to take a while to catch up. We've lost a lot of good nurses, and people are a little bit gun shy of going into nursing, because they've seen what it, the toll that it's taken. So yeah, those would probably be some of the biggest things I'd like to see. I'd also like to see no more eating of the young, I guess is what they call it. I think everybody has they're an important piece of the machinery. They have things to offer, and I have learned a lot of things from new grads.
Yeah.
I've learned a lot of things from people that have been there longer than me, and I would love to see that kind of an environment where not only the new grads feel safe sharing things, but that it's accepted, and feedback can go both ways.
Can go both ways.
Yeah, I would like to see that kind of an environment fostered.
Yeah, yes, so many nurses talk about that. And I wonder, how did we get to that place? Not that it's new. It's been that way for quite some time. Um, my personal feeling is that a lot of that is born out of insecurity. Things change so fast, and it's so hard sometimes to keep up. And all of the personal stuff that goes into it, that just as how the patients lash out at us, I guess we tend to, you know, which is not necessarily a good thing. But so you talked about people may very well be gun shy to come into nursing at this time.
Mm-hmm.
So what would you say then to someone who wants to, or who's thinking about it?
I consider myself blessed, and when I was looking through the questions that you had asked about, like
Mhm.
the biggest achievements and
Yeah.
that, I've done this for 40 years, and I love it as much as I did when I started. I'm tired, and I can't do the bedside anymore.
Mhm.
I still love it. And I would encourage anybody wanting to do nursing. It's flexible. If you get bored in one area, you can choose another area. Like it's always changing. It is it's demanding, it's exhausting, but it's exhilarating, and it brings joy at the same time. It's like you've got all of these different dreams. Sometimes it's in the same shift.
Yeah.
But I would encourage anybody to look, if they're looking at going into nursing, make sure that they have their self-care, their know their limits, have healthy mental health habits, have healthy lifestyles, that's going to be your basis. That's going to get you through.
Yeah, yeah.
And stick to those. Mental health is a huge part of nursing. We see a lot, and we need to be able to process that. And I don't know that that's taught enough in nursing school.
Absolutely.
So I would still encourage people to go into nursing. I think there's so many things that you can do with it now.
Yeah. The things that you can do with it have no limit.
They really don't. They really don't.
They don't.
You can go to any part of the world.
Any part of the world, in any area, doing I say off frequently, I keep trying to think of one area where I couldn't function as a nurse. I still haven't come up with one.
No,
I still haven't come up with one.
I don't know if they've gone to outer space yet, but they probably should.
Exactly. Exactly. But you talk about self-care, and you talk about wanting to see that. You would tell a young nurse about this. And you quite specifically mentioned that we don't talk about it. Back when I became a nurse, those two words just didn't even go together.
No.
And you know, and then mental health, your mental health, what mental health? You know, and I think that the idea was to encourage you, in fact, to go beyond your limits, to cheer you on. Yes, she doesn't feel well, but here she is. She's pushing through. Some of that still although we're talking more about self-care, I think some of that still lingers today. And kind of wish it didn't. Because you really can't adequately, let alone very well, take care of someone if you're feeling that way. And I'm really, really excited to see that the young nurse is coming along and not putting up with the things we put up with.
Yes.
I'm happy about that. But you mentioned a question I had asked about greatest achievement. So what would you say is your greatest achievement so far?
I really think my greatest achievement is doing this for 40 years and still loving it.
Yeah. Yes, indeed. Yes, indeed. And it comes in those, in those ups and downs, in those waves. I can remember as a student nurse, as a qualified nurse, as a midwife, and whatever, many times when I say to myself, I am done. I'm not doing this anymore. And by the time I wake up the next morning, I am raring to go.
Yep.
It comes in waves, I'll tell you.
Yes, it does. It does.
So you have worked your way across Canada, which for me is a big thing, which means you have seen, I fully understand. I've worked in different places and I fully understand that. As a nurse, what is required of you in one place is not necessarily the same as what's required in another place. You're a nurse, you're giving basic care, you're giving nursing care, but sometimes what's expected of you is slightly different between policies and procedures and, what your scope of practice is. So what would you say, what would you like to see then, if anything, let's say, standardized across Canada?
I think across Canada, I don't think there's as much differences in what the nurses do. Where I find the difference is urban areas as compared to rural areas.
Okay.
And I find that different. And as a new nurse, I think working in a rural area can be very overwhelming. Because you don't have the backups. In the larger centers, you've got something's going south, you've got lots of people that can help. You've got like respiratory, you've got you know, your lab techs, you've got people doing ECGs, you've got all of
Yeah,
that kind of stuff. Rural areas,
you
there's
don't have that.
no, you've got maybe one or two other healthcare workers, and you've got the doc, and
Mhm.
and and that's it. And sometimes the doc is not an emergency doc; it's a family doc.
Yeah.
So that's probably where I notice more of the differences. Um, Scope of practice, I think they have tried to keep that the same across Canada. I haven't noticed much
Mhm,
difference with
mhm,
that.
mhm, 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 mhm. Yeah. So given that we're talking about rural and urban areas and stuff like that, and we're talking also very much these days about, the influx of all kinds of technological stuff.
Mhm.
How do you think that we can use technology to kind of, you know, even out the two?
I've seen it work very well. With I work at, or I was working in a hospital that's maybe half an hour away from a larger center, and they're doing a lot more FaceTiming with
Okay, good. Mhm.
the, like, if they've got a pediatric patient, they actually will do FaceTime with pediatrician, and they can take it to the bedside so the pediatrician can actually see the child. They've got the information, and so I think that is really, it's really helping. Um,
Yeah,
the docs that are not skilled in everything, and
right.
they're family doctors,
Yeah,
they're doing
and
the best they
they should.
can. Yep.
Hmm.
So I really find that has helped, because we're definitely seeing sicker patients in
Indeed,
in
we are.
in
Mhm.
rural areas too, because a lot of people during COVID did not go for regular
Yeah,
treatment.
yeah.
Diabetics, so they're
Hmm.
scared to go into the doctor's office, so
Yeah,
things were left, and so they
yeah,
progressed, unfortunately. So we've got a lot
yeah,
sicker population.
yeah, yeah. Gotcha, 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 gotcha. So you segued into writing.
Hmm.
Yeah. Um, how how satisfying is that for you?
I'm enjoying it. I always loved writing. Um, I mean, I grew up with two parents that were storytellers. I'm married to a storyteller, and our kids love stories. And so that's been a part of of our lives. I've always written poems for special occasions for family. And when I came across like the RN to Writer
Hmm.
course, and realized that I could actually share what I
What you
wanted
know?
to get across, what I'm like, the simplified information that people can understand. A lot of times we don't have time anymore
I
to
know.
sit down and get that information across. And this was an avenue to do that, to make sure that people understood what they needed to understand about their health condition.
So many things, so many things.
And but it also gave me as I started writing, it gave me an opportunity to reach out and encourage my peers. That's one of the things I left. I've left the bedside for health reasons, but that doesn't mean I don't care about what's
Yeah.
going on. And I and I've burnt out a couple of times over my career, and so that's something that's very close to my heart, is getting the message across to other nurses, other healthcare professionals. You're not Superman. It's okay to say I'm not coping. It's
Yeah.
okay to ask for help.
Yeah.
That's not, it's not a weakness. That's actually strength.
That's actually strength. Yeah.
And so this I'm really liking having a platform to be able to say those kinds of things.
Absolutely, absolutely, absolutely. What would you say if you had to describe what to you is the most essential quality of a nurse? What would that word be?
Compassion.
Compassion. Okay.
And it's not just compassion for the patient. It's compassion
Mhm.
for those around us as
Yeah.
well.
And for ourselves.
Yes, that I'm learning slowly.
Mhm.
I keep apologizing to my kids, and it's like, I'm really sorry. I should have learned this a long time ago. I did not model correctly to you guys. And fortunately, I've got a good husband that keeps me in line. I think I'm learning new things, and he's going, I've been telling you that for how many years now?
Okay, so I'm ready to hear it now. Okay.
It wasn't my idea? No.
Oh dear, oh dear.
Yeah, I think if we lose our compassion, it's sad.
It's sad.
People come to us and they're hurting physically, but they're hurting mentally, and they're hurting in their spirit.
Yeah.
And I think everybody deserves to be seen, and they deserve to be heard. And that's across the board. Not
Yeah.
only who we care for, it's everybody that we come in contact with. So that's where I would say compassion.
Yeah, yeah. And you mentioned hurting physically and hurting in every other way. And that is so, so profound, because physical hurt is just the hurt that we are able most easily to describe. But it comes with mental and emotional hurt. It doesn't just come by itself, no matter what it is. So yeah. Lastly, but not leastly, what do you do for self-care? What do you do for you?
I'm learning. For self-care, I making time for things that actually fill my cup. And trying to balance that. I'm learning my limits. And I heard, I'm not sure where I heard it, but somebody said that no is a complete sentence. Because I always have to give an excuse for why I'm saying no. But I'm learning no is no.
Good enough. Yes.
And I am trying to develop healthy habits, and I am getting back into starting my day with God and centering. It's like just centering down. These are my priorities. What am I going to go out and do today? And I find when I do that, it just flows better. And so, and I lost sight of a lot of that for several years. And I think part of the writing has helped.
Yeah.
It's helped shake down the things that really didn't need to be there and really weren't important, but we busy our lives up with those things. And so, yeah, those are the things that I'm learning for self-care.
Yeah. I am right there with you when you say no is a complete sentence. I no, I cannot. I didn't even say no. I'm going like I cannot, because I'm learning that with you.
It's hard.
It really is hard. It really is hard, because you know what? By education, and I think innately too, as women, As women, nurses, mothers, and education, we feel that we've got to do it all. And if we cannot do it all, or if we don't want to do it all, then there's got to be some big reason that we have to give. Doesn't
Yep.
Yeah. Ruth, I don't know how to thank you for this conversation. It has been great. Thank you so, so very much.
Oh, thank you. It's been wonderful talking to you.
Andrew, it's my pleasure, really. Thank you.